rapid and reversible fashion. And this is what I find quite fascinating, because historically we used to think from a clinical standpoint that something would happen to someone's gut barrier function, it would result in changes to those tight junctions and then remain open unless we had some way of repairing that. What we're starting to see now from the scientific research is that these junctions are opening and closing in response to environmental factors. Now, environmental factors could be bacteria, it could be food that we're ingesting, and we're starting to see a huge interrelationship between these tight junction transmembrane proteins opening in response to gliadin, for example, from wheat. Occludin is a transmembrane protein that has adhesive properties. So remember, these transmembrane proteins are trying to be involved in keeping one enterocyte attached to another. At this stage, the role hasn't been fully elucidated. We know that it requires the interaction of claudins to form the paracellular seal, and we also know that occludin is significantly decreased in the mucosa of patients with irritable bowel or inflammatory bowel disease. The claudins family are another group of transmembrane proteins located at the tight junctions. At this stage, we know there's at least 20 family members, and studies are suggesting that these tight junction fibrils can be reconstituted from the claudins, and that they alone can actually form a paracellular seal. And going back to this slide again, it's quite a good one just to depict here where everything sits. I'll just bring up my slide again too. So this process here where we have one enterocyte beside another, this tight junction area that we once thought was a sort of static process that was occurring, we now know it's rapidly reversible, it is changing, and that can be disrupted by a number of factors. It can be free radical damage, bacterial endotoxins, which we're going to discuss in detail, and then followed suit, it results in the disentangling of these transmembrane protein molecules. Mediators of tight junction disruption include, as I mentioned, reactive oxygen species, bacterial endotoxins. Now, we definitely have seen from a scientific standpoint the relationship between lipopolysaccharide or LPS from gram-negative bacteria, but there's thought now, and I mentioned this in last week's lecture on biofilms, that maybe from gram-positive bacteria there's a substance called lipoteichoic acid, and this is also a bacterial endotoxin which can interfere with tight junctions and also maybe be involved in biofilm formation. Now, just to recap, our gram-positive organisms would be things like our MRSA or Staphylococcus aureus, Streptococcus. They're all gram-positive organisms, then we think they may have a role in endotoxin production. Now, I'm just going to give a little bit of a recap here on the immune system, because this is going to have value in terms of the interrelationship between tight junctions and the role of leaky gut. So it's a rudimentary chart, I know, it does give you an idea, but what we're looking at here is Th1. Here we're primarily looking at cell-mediated immunity. It's involved in the protection against viruses, cancer, protozoal infections would also come under this category. And then we have our Th2 or humoral immunity, which is our allergy-based immunity. And this is just a loose depiction of where they are, whether they're moving more towards an anti-inflammatory cytokine response or whether they're actually moving up here to be a more pro-inflammatory cytokine response that we're seeing. Now, with our Th1 and Th2 cytokines, we know that with interleukin 10, it's going to be suppressing Th1. And our interferon gamma is going to be suppressing the Th2 process. Now, for those of you familiar, Th17 has become a new T helper standalone, I guess, part of the immune system that we're looking at. And Th17 comes from, similarly to Th1, Th2, it is coming from a T